Aloha Kauai, happy Good Friday. Here's our daily COVID-19 briefing from Team Kauai for Friday, April 10th. The number of total confirmed cases remains at 19. Of those 19 cases, 13 individuals have either recovered or returned to their home on the mainland. The remaining 6 active cases are residents, 3 are in home isolation, 2 are in an isolation at a facility, and 1 remains in isolation at the hospital. All but 1 case has been confirmed to be travel-related. There is no clear source of infection for 1 case, and therefore, it has been determined by the Department of Health to be our first case of community transmission. Kauai's tally of cases and other information on COVID-19 can be found on the Kauai Emergency Management Agency, or KEMA site, at www.kauai.gov/COVID-19. To view the total number of positive cases across the state, please visit hawaiicovid19.com. The daily count on this site is updated at noon every day. Regarding the new update on the determination of community transmission with one of our positive cases, I'd like to bring our District Health Officer, Dr. Janet Berriman, up to explain that in a little more detail.
Mahalo, Mayor. For the last few days, we in the District Health Office have been working on getting more information about the possible source of infection for one of the COVID-19 cases in our community. As you know, 18 of our 19 cases have been clearly related to travel. This case is not. This is our first case of community transmission, which is a significant milestone. It's one we've been expecting and preparing for, but it's still unfortunate. What this means is that the risk of becoming infected with COVID-19 is not just from traveling or from being around travelers, but is also from interacting with each other here in our own community. We all need to continue being extra careful in taking the precautions that we've been taking in recent weeks. We need to wash our hands frequently. We need to stay home as much as possible. We need to keep our distance from others when we are going about our necessary activities. And we need to wear cloth masks when we're outside our homes, even in our workplaces. It's important to stay home if you're sick. You can call your healthcare provider or a clinic or urgent care center if you're concerned that you may have COVID-19. The healthcare provider can order a test for you if it's needed and tell you where to go to get the sample collected. You will need to stay in self-quarantine at home while you wait for the test results. I know these are challenging times, and I want to thank you for all you're doing to keep yourself and our community safe and healthy. Mahalo.
Mahalo, Dr. B, for helping to keep us informed. Folks, we've been sharing information on county office operations, but one question that continues to come up from the community is, how do I file for unemployment insurance? The Unemployment Office is managed by the State Department of Labor and Industrial Relations, and they have admittedly been having difficulty in processing the drastic spike in new applicants in recent weeks. They have been making continuous improvements to their operations and have relayed this information on how to file a claim. Claims can be filed online at huiclaims.hawaii.gov. For those who have trouble accessing the website or need more information, you can call the newly established toll-free statewide call center. For HUI password resets, please call 1-833-901-2272. Call center is 1-833-901-2275. To reach the local Kauai's claims office, call 274-3043 or email dlir.ui.kauai@hawaii.gov. If you continue to have difficulty using these resources, the Governor's Liaison encourages applicants to contact the Governor's Office at governor.hawaii.gov and click on Contact the Governor, and someone from the Governor's Office will respond to assist you. As a reminder, a new mandate goes into effect this Saturday, requiring all employees of food establishments, grocery stores, and stores that sell medicine to wear masks. Additionally, we strongly recommend that all businesses, regardless of what you sell, require your employees to wear cloth masks. We are also strongly urging all public-facing businesses to require your customers over the age of 10 to wear cloth masks to enter your business. In fact, we strongly encourage all individuals over the age of 10 to wear a cloth mask or face covering anytime you're outside in the public. I want to take the time to say mahalo to those of you who are voluntarily wearing masks while out in public. Let's be clear about the recommendations. If you're in a place that puts you near people outside your immediate family, you should be wearing a mask. If you're at home or out by yourself, swimming or jogging, you don't need a mask. But if your path takes you within 6 feet of other people, whether it's out walking or shopping, then you should be wearing a mask. And your mask should be washed or sanitized daily. We're still learning about COVID-19. The disease has only been around since November, so there is still much to understand. We are learning that it spreads very easily. It is carried on respiratory droplets. If someone's sick, coughs, or sneezes in front of you at the store, you could be at risk of infection. But if someone is wearing a mask, there's much less chance those virus-carrying droplets will reach you. We're also learning that people can be infectious even if they don't feel sick. You could be spreading COVID-19 viruses and not know it. People around you could be spreading the virus and not know it. So the best thing we can do to protect ourselves and others is to act as though you have the virus. Act as though others around you have the virus, and then act accordingly. Remember, folks, my mask protects you, and your mask protects me. Let's work together to protect each other from coronavirus. We can also continue to protect each other by staying home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, keep a distance of 6 feet of separation and wear a mask. Do not leave home if you're sick unless you're seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. With our stay-at-home order, we now have less cars on the road, but more pedestrians. Motorists who must be on the road for essential needs, please slow down and drive with aloha. And pedestrians, please wear bright clothing or reflective attire to make yourselves more visible to motorists. Let's work together to keep each other safe. We're going to get through this, Kauai. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Center for Disease Control is also updating its website regularly. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. Once again, Kauai, we can do this. Hang in there and take care of one another. God bless and aloha.